Hello, my name is Amber Brown, and I'm a third year pharmacy candidate attending Florida A&M University College of Pharmacy in Tallahassee, Florida. I would like to first thank you for taking the time out to listen to my YouTube presentation on my journal club in regards to insulin Degludec versus insulin Glargine in insulin-naive patients with type 2 diabetes. Insulin Degludec is an ultra-long-acting basal insulin analog that was developed by Novo Nordisk, which also could be found in the brand name of Tresiba. Tresiba is indicated for long use in combination with oral anti-diabetic medications or bolus insulin. Approved for glycemic control in adults with type 1 and type 2 diabetes to provide a long duration of action with at least beyond 42 hours. The objective of this trial was to compare the ultra-long-acting insulin Degludec with Glargine for efficacy and the safety in insulin-naive patients with type 2 diabetes inadequately that are controlled with oral anti-diabetic drugs. This was a 52-week randomized controlled parallel group open-label multinational treat to target and non-inferiority trial. This trial took place in at least 166 sites in 12 countries, including Australia, Belgium, Canada, France, Germany, Norway, and things of that nature. The study was conducted in accordance to the Declaration of Helsinki and the Good Clinical Practice Guidelines. It was approved by the institutional review boards and independent ethics committees before initiation. Basically, in order to be used in this trial, patients had to be at least 18 years old. They had to have been diagnosed with type 2 diabetes for at least 6 months or greater. They had to have an A1C 7 to 10% and a BMI equal to or greater than 40. And also unchanged doses of oral anti-diabetic agents for 3 months or greater. Also, the patients were those who were on GLP-1 agonists or TZDs within 3 months of screening, the hepatic, renal, or oncologic disease, recurrent severe hypoglycemia or hypoglycemia unawareness, and proliferative retinopathy. Type 2 insulin-naive adults diabetic patients was the subjects, and the primary and secondary endpoints were the change in A1C from baseline and also the change in baseline labs. Again, the follow-up was taken towards the end of the 52-week trial of the study. And the population consists of insulin-naive patients with type 2 diabetes that were inadequately controlled with oral antibiotic drugs. Adults with type 2 diabetes with an A1C 7 to 10% taking oral anti-diabetic drugs that were randomized 3-to-1 to receive once daily Degludec or Glargine. Both with metformin, insulin Degludec was also administered once daily with main evening meals, and Glargine was administered once daily at the same time every day. The starting dose for both of these insulins were at least 10 units, and each participant insulin dose was titrated to achieve pre-breakfast plasma glucose. Basically, the trial's primary objective was to confirm the non-inferiority trial insulin of Degludec to Glargine by changing the A1C from baseline after 52 weeks with a predefined margin of at least 0.4% for treatment difference. In total, 984 participants were to be randomized for a power of greater than or equal to 95% per protocol analysis, and analysis was performed in the intention to treat group. Safety endpoints, hypoglycemia, and body weight were assessed in all who received treatment, and treatment differences in A1C, fasting blood plasma glucose, like functional health status, the insulin dose, and the body weight, and the 9-point self-monitoring blood glucose were all analyzed with ANOVA. The numbers of treatment confirmed hypoglycemic episodes per patient year of exposure and were analyzed with negative binomial regression model. The baseline characteristics were well matched between the groups, and the mean overall study population were people who are at least 59 years of older and also were diagnosed with type 2 diabetes for at least 6 months, with a bare minimum of the A1C between 7 and 10, and then also again with the BMI equal to or less than 40. and they were treated with unchanged doses and dosing frequency of anti-diabetic medication as far as like metformin monotherapy, or if metformin was used in combinations with other insulins, or alpha-glucosidase inhibitors for more than 3 months before the screening. The primary and secondary endpoints was confirmation of the non-inferiority of the Degludec to Glargine and A1C reduction after the 52-week trial intent to treat analysis. The second endpoint was the change in baseline labs, the fasting blood glucose, including the self-monitored glucose, and also, of course, the A1C less than 7%, and the functional health status. The most adverse events that were displayed were nasal pharyngitis, headache, diarrhea, and of course hypoglycemia. The injection site reactions were rare and were non-severe. Also, there was weight gain similar between the two, with a p-value of 0.28 at the end of the trial, and that also this is a type 1, which also means no difference, were observed in other lab values such as like total cholesterol, LDL, HDL, TGs, and things of that sort. The author's conclusion was that the insulin Degludec provides similar long-term glycemic control, and the rates of the nocturnal and severe hypoglycemia were lower with insulin Degludec, and also these findings illustrate the beneficial profile of the new basal insulin. Some of the strengths that were recognized was that the insulin Degludec achieved overall glycemic control similar to that of Glargine, but with lower nocturnal hypoglycemia rates, which overall was reduced by 36% in relation to Glargine. And also that Glargine could be taken any time of the day, which I think is a great benefit for the patients that were taking this type of insulin. Some of the weaknesses that were reported were basically that the race and gender selection was not proportionate, and that the open label trial design posed a risk of reporting bias by the subjects. And also that the titration schedule was not discussed with the subject as well. A brief summary basically of this primary literature was that the study was designed as a treat-to-target trial to allow efficacy and safety comparisons of new basal insulin Degludec with the most frequently prescribed basal insulin Glargine. Insulin Degludec was non-inferior to insulin Glargine with limited surprise of the insulin Degludec, lower A1C, but also reduced the rate of nocturnal hypoglycemia. Hypoglycemia at night was not an issue prior to the study, but however, the findings were not significant enough to place a formularies of insurance companies. Detamir and Glargine are the only basal insulin that's on Medicaid formularies, and that Detamir is pretty much the preferred agent. In conclusion, insulin Degludec and Glargine administered once daily in combination with other anti-diabetic agents provided similar long-term glycemic control in insulin-naive patients with type 2 diabetes. However, after all of these findings and some of the great strengths that were seen in this study, the data obtained did not provide prevalent evidence or significant differences in price, especially the prescribing habits. Again, I would like to thank you for taking this time to listen to my YouTube presentation on my journal club in regards to insulin Degludec versus insulin Glargine in naive patients with type 2 diabetes. Thank you and have a wonderful day.